The summation of human experience is being expanded at a prodigious rate, and the means we use for threading through the consequent maze to the momentarily important item is the same as was used in the days of square-rigged ships, which is a harsh criticism, but true. We're talking about cards, index cards, trying to find that article that you saw 2 years ago, and you can't quite remember what it was about. But you can't remember who wrote it, but we knew exactly what it was about, and you need to recall this urgently. It's a visionary article because he was a scientist and he laid out what he thought was going to happen, what in fact he thought was inevitable to happen, because he had noticed how during the war commercialization had made things cheaper in terms of communication. So he dreamt up the idea of personal computers, which he called Memex machines, because they're extensions of the human memory. And virtually everyone has their Memex now. He talked in terms of associative trails, but we know this as hypertext, the way that we pull out, they're hooks that we can pull out bits of information from the ether. He thought of the World Wide Web and interconnectivity of users and the internet itself. He was thinking about the concept. He didn't develop it, but he already saw the concept, and this was in 1945. And then he said something that should, I think, be burned into the wall of every library in every university. A record, if it is to be useful to science, it must be extended, it must be stored, and above all, it must be consulted. Now, I'm taking the use of the word extended to mean accessed. It must be accessible. So it's not just in the journal, it is somewhere else as well. It is extended. We've already had mention in the preceding couple of days about various debates that are happening outside this room. There is a stream running at the moment with the Lancet through the HIFA, HIFA web package, talking about repositioning African global knowledge production, because people are waking up a bit late to the amazing amount of research that's being done in Africa. We've got the African Institute for Development Policy. Now, these guys are very interesting because they take their role as not telling truth to power, but getting knowledge to power. Our parliamentarians, it's not just the governments, it's not just the ministries, our parliamentarians are not advised enough. They do not have ready access to the knowledge that allows them to, if you like, challenge the government or help the government or understand what the issues are. It's just as important that the parliamentarians have it for democracy as it is for the government. And HIFA, again, has been running this thread, when will developing countries stop importing knowledge? Now, everyone has their own take on that. My take is, having been working in the cancer information in developing countries for nearly 20 years now, is that it's good to have everybody access, but if you find that you're only getting things from Memorial Sloan Kettering or Mayo Clinic and it's not going to help you, then sooner or later you're going to get pretty tired of that. And I happen to know, and it's quite clear, that there's lots of good research being done here that is languishing at the moment and needs to come out into the light. There's been a concern about quality. I think the concern should be that of the lack of access at all, good, bad, or indifferent, to the research being done. So I've dreamed up something, taking Vannevar Bush, the Bush test. A record, is it accessible? Has it been stored? Has it been cited? Because that shows use, that shows that it's been consulted. I did a very quick review, but I say quick review, it only took 2 weeks, of 4 African University institutional repositories, one of which I think is in this room. And I said, right, I want high quality, I just want to look at the PhD theses. I only want to look at cancer because that's my interest and I think that's fair. You come to it because you're interested in a particular thing. You're not doing this for the whole of humanity, just for your thing. And I don't care really when it was published, and I certainly don't care what language it was in. I'll take everything. If I need to find a translator, I'll find a translator. The exclusion criteria was, thank you, I don't want master's theses, and I don't want veterinary theses, cancer in cattle and so on. So I looked in countries of Ghana, Kenya, Nigeria, and South Africa, and I applied the inclusion criteria. And I checked the institutional repositories for the universities I found, and then I checked those against the Google Scholar, because that's, and I've got it on my, yeah. The results were, I found 179 pieces, reports, dissertations, and theses, but only 47 actually fits the inclusion criteria. Of those 47, all 47 were accessible in full, easily on the institutional repository, which is the score. That's great. When I went to Google Scholar, I found that only 35 you could get the full PDFs. Okay. So there are 12 different, and 7 were not at all there, and 5 were they just said cited. They just said the word cited and the name, and it didn't give you a link. So that's not very useful for you. So, okay, 35. And I found that of those on the Google Scholar site, 14 of those 47 had been cited. Then look for publications, and here I know I'm going to get a mismatch, because I know everyone's been telling me, oh, actually, as part of your PhD, you've got to have things published, and some people have must have one article, and some universities demand 2 articles. But I tell you, I couldn't find them. I couldn't find all of them. I could only find 34 out of the 47 that I could consider at all were related to the PhD dissertation. I'm not saying they're not there. I'm saying I couldn't find them. And of those, 19 were cited. So what's the scorecard? What's our report card? Is it accessible? 100%. Terrific. Has it been stored? Well, 100% if you go to the institutional repositories, but only 74% if you go to Google. Okay, that's how it is at the moment. It's just a snapshot. Has it been consulted? Well, we know 34 or 72% have been published. We're sure of that because we found them. There might be others, but we're sure of those. But just because you're published doesn't mean you're cited. And what we found was only 25 had been cited, whether it was in the Google presentation or through the publication. And in fact, what I found was that nine of the PDFs that I got from the institutional repositories, but I couldn't find publications for, okay, were cited. All right, and if they did have publications, then those hadn't been cited. It was the Google record that had been cited. Okay? So what's the observations from listening to you and knowing what I know already before I came here was that many countries in Africa have an artificially low global research profile. And I won't go into great detail about this, but my take on this is that if you're African, it's quite difficult to get your research published in high-level journals. That's the first thing. And secondly, because it is not immediately apparent that that research has been done, people assume that it hasn't been done. It's one of those, if a tree falls in the forest and no one hears it, has it fallen? Well, of course, the answer is yes, it has. And the research has been done, but it's not out there in terms of, it is in the university, but it's not out there in the wider world. Digitized records of dissertations are accessible, but again, the repositories are not well known. Now, if we were talking just before lunch about having an ADHL central, this might be one of the answers to that. Coverage is patchy, and access frustrated by vulnerable links, firewalls, and slow speed. It took me 2 weeks because sometimes I just couldn't get through, and I was just determined to find the information if I could. So this much we know. We also were, I think everyone was impressed by the University of Nairobi, the robust infrastructure they've got there for digitization, and that people around the table are at different stages of development. Fine. And we're all subject, I think, to external vulnerabilities, like the power outages, the virus attacks, Our friends from Zim mentioned the Forex situation that stopped them buying important equipment, the slow internet speed. These are things probably we can't do anything about. This is the world in which we live. But there is concern also about sustainability. What happens when the project ends? And I want to address that directly. There's also a recognised need to move beyond silos that we're in. I think people will feel better if more people know about what they're doing, and we have to move beyond the silos. We also have to talk to other universities. We have to grow the network if we can. Grow the network and bring people in. And what will grow the network is evidence that you're producing something really, really meaty. So what is the endpoint? Is the endpoint all the theses that you've got are digitized and that they've been used perhaps to raise academic standards? We were talking about quality, the worry about quality, about publication. I think we've made a decision on that. You publish, you put it out there, and then let the chips fall where they may. And it will help bring standards up if they need to come up. But is that the endpoint? I'd say no, that's the outcome. That's the outcome. That's what's going to happen. All your information will be out there, and the academic standards, when they need to, will rise. Well, perhaps the endpoint is having all the universities digitized, and having parity with the North, and break through this culture of separateness that's operating. Is that the endpoint? To build what we can call the African powerhouse, because the intellectual wealth of this continent, and I'm not being dewy-eyed and northern and white about this, I can see it, it is clear, it is not at all deniable. You have gold here. Is that the outcome? And the answer is no. That's the vision. That's what you're ending up for. You might never get all the universities. And things might happen, but you can certainly move towards in this direction, and you should move towards this direction. So the endpoint, I would say, are twofold. To become an essential service to your university, which will allay your concerns about sustainability, and to enable access to users. And if those are the endpoints we're looking for, then we can mark that, we can measure them, and we can see how we're doing. So in brief, it's to become essential, become a core function, to enable the world to benefit from your work. And I would see this as actually quite doable, because digitization and the evolution of knowledge storage and access is now irreversible. We're not going to go back to shelves on books. It's like saying we're giving up the car or we're giving up aeroplanes. We're not going back. We're only going forward. And people who are in the funders have to recognize that. We're only going forward, and this involves digitization. This is the very least one should be doing. We're talking about what we call the new normal. That it is to be quite normal for students to be able to come into, to expect their university to have at their fingertips all the accumulated knowledge of previous generations or previous years. And we should use it also to promote the university and to promote the nation. This is a national interest story, as well as not just the university. We're playing for bigger chips here, and it's far more important than our own individual libraries. But without the libraries, nothing can be done. So how do we get there? Well, there are 8 stages I'll quickly go through, and the first one we've already done. The network of African medical librarians, the ADHL library, it's just proof positive what Margaret Mead said. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that has. And I have to say this, I want to add a personal note. I'm immensely honoured to be in this room, but I've been in this room before. 25 years ago, as when I was a much younger man, had far more hair, I was asked to come and join a group called the Cochrane Group, who were meeting in a refurbished biscuit factory in North Oxford. There were 80 people there. They were all volunteers. They'd all paid their ticket. And they had just come together with a decision that they couldn't stand it anymore, the lack of evidence being used in healthcare. They wanted to bring evidence into healthcare. And there was a buzz about the room, there was a feeling, there was an atmosphere in the room, and these people were determined. And I got exactly the same feeling about you, this group. So I have absolutely no fear that you're not going to succeed. It's an honour to be here. So first of all, I would say we have to set our minds. This is not an ordinary situation. We're not doing the ordinary. The ordinary is not to do this. The ordinary is just to leave things as they are. We're actually saying, no, we're not going to do that. We're going to do all this, take all this grief, do all this hard work, and we're going to change the way things are done. And the fact is, you've got a small band of brothers and sisters here, and that probably nobody can take your place. I'm sorry to say this, but if all your planes went down on the way home, or the taxi crashed or whatever, are you absolutely sure your universities would follow through on this? You know, you are actually irreplaceable, and like it or not, you are that group that Margaret Mead was talking about. But there are allies. There are people thinking exactly the same as you and want what you want to do. And the job then is to find them. And of course there'll be opposition. It's too much money. Can't be done. We haven't done it like this before. And we've got to have arguments that win them over. Not defeat them, but win them over. And that's a different thing. Because lives depend on our mission succeeding. We're not just talking about records. We're talking, the end point finally is to get this knowledge into practice and improve the life of everybody being treated with healthcare. And this, who was it? Who was it? Nancy? Was it? This is about talking about a project. This isn't a project anymore. This is the near future. You might be calling it a project in your university. It might say on the contract it's a project, but it isn't really. This is going to go on, and this is the near future. Now, how do we make that happen? Well, fortunately, you work in universities as opposed to businesses. The universities are based in principle on the concepts of consultation and accumulation. That you should consult previous research before doing your own. Well, you're making that easier. You're making that 100 times easier than before. And we're talking, as mentioned, systematic reviews. I've done a number of systematic reviews. I cannot tell you the massive advantages it is to be able to download a digitized record, a digitized format of a journal article that you badly need the data from. Systematic reviews are one of the building blocks of modern healthcare. This serves that purpose. And it will add luster to all university work if this is able to be done. So we have to promote the new normal. I would say this is the way we're going to go on, and keep records of use, because again we will have opposition. And you need to show, but minister or but chancellor, where you have all these things, people using us, relying on us. And the final point there is to become an essential service, so that people will not think about turning this off. They will rather think about turning off the electricity or turning off the water. This is an essential service for the university. Now, obviously, we've got to build strategic alliances. There will be some talk about that, obviously within the university, but also with other universities. And I would ask, for example, all the Kenyan universities, is there a strategy for bringing the Kenyan universities all together? I know there is competition. Certainly between the heads of the universities. They all want the same students. They all want the funding, of course. But there mustn't be competition amongst this group. There can only be collaboration, because otherwise it will not work. And there's strategic alliances with, obviously, the Ministry of Health and Ministry of Education. Gentleman from Mali, where are you? Sorry. Did you say that you had a room set aside for the Ministry of Education? Did I dream that you actually had a space set aside in your university, or that you could use in the library?
Yeah, a space for the National Research Network.
But that's education, isn't it?
Yes.
Yeah.
Education and research.
Yeah. See, this is terribly smart. This is terribly smart. We can't just be talking to the health ministries. We've got to branch out and make alliances with other. And the people you really want to make alliances with is the Ministry of Finance, because it's the story of Willie Sutton. Willie Sutton was a famous American bank robber. Well, he wasn't a very good one because he kept getting caught. But a reporter said to him, "Tell me, Willie, why do you keep robbing banks?" And he said, "Because that's where the money is." And there's the wisdom there. It's very good you're talking to the Ministry of Health. It's very good you're talking to the Ministry of Education. But it's the Ministry of Finance. You have to get into their ear. And there are ways we can do that. And we'll talk about that in a moment. So we also built strategic alliances with external national partners. Again, let me take Kenya as an example. I don't know how active KENCO is. That's the Kenyan National Network of Cancer Organizations. I don't know how active it is, but I come from a cancer background. I imagine several of you have already had experience of cancer. Nobody wants information, high quality information, more than a cancer patient and their families. So if you're only thinking about serving the doctors and the nurses and the pathologists, well, yes, that's all well and good. But the people who really want this are actually the patients. And that's why we're talking about bringing the patients in fairly early when you're discussing how you can disseminate, maybe doing mobile apps. I have also to say this because it's not right not to say this. The continent of Africa is going to face such an onslaught from cancer. It has already started. We're talking about language, how English was the predominant language, and French is a beautiful language. But neither actually give you the correct impression of what's going to happen here, because it's happened elsewhere as well. The only word I can think of is a Japanese word, tsunami. There's a tsunami of cancer coming to this continent, and it is as well that we gear up for it, and that the universities are fully 100% behind providing high quality information to the policymakers, to the health service, and to the patients as well. So, and of course, you want alliances with business. You want to be able to hold meetings. You want someone to fund them. And if it has to be Barclays Bank, it has to be Barclays Bank. That's the way of the world. And you also want alliances with media as well, so that when you've got a story to tell, you don't have to struggle. They know you, first name basis, and getting the story out, saying what your university has done, what the library has done, what the network has done. We obviously want to attend conferences and talk about the network and talk about the digital library. You'll also want to host meetings and events, and again, that often involves funding. Publish reports, and generally build up a support base for the library. And this brings up the whole communication strategy. Somebody somewhere has to sit down, even if it's on the back of a beer mat, and dope out a communication strategy for your library, and also for the digital library, and also for the network, which answers the main questions, like who should we be talking to? Why should we be talking to these people and not those people? How should we be delivering the message? Where and when are we going to be doing this? And what are we going to be telling them? And I would say the message is that digitization is a national service. You're doing this for the benefit of your country. And you're doing it for the benefit of your university, and you're doing it for a greater benefit as well. Because the policymakers need an information strategy that's easy for them to use. Their time is limited, their knowledge of this is negligible. They need to be able to get it fast and get it reliable. There is an influence. The private sector, of course, is influential. Of course, it has something to sell. But you also have something. You have knowledge. and within a country to go to the government and say, how do you want your information? And I would say that the next step forward should be, at some point next year, to actually hold a meeting, if you can do this, where you bring this with policymakers and civil servants and actually nail this down and say, well, we've got all this information, this is good stuff, how do you want it? We don't expect you to have it all at once, we expect you to draw on it when you need it, but how do you want it? And the answer would be digitized, of course. And that will help strengthen the case within the university of it being a part of the essential infrastructure. We have a situation, Francis Bacon said knowledge is power. Well, yes, it is. Knowledge also doesn't bring happiness, unfortunately, but it does bring power. But what we have a situation now is that we have the knowledge and they have the power. The power and money is elsewhere. And we need to say, okay, you need to be informed. Okay, and we have the information and we want to give this to you. But we can't ignore the fact that knowledge is wealth. And we should move towards improving connectivity. The discussion around the ADHL central service was good this morning. This is just beginning, and I think it should continue, because that might very well be the way forward. I think it probably should be. In the meantime, at the Commonwealth Health Ministers meeting, I wrote the paper the position paper for the Commonwealth to discuss through the Commonwealth Secretariat. And they have agreed that they should establish an evidence base for cancer control that will provide faster access to the growing body of research into cancer. You know who I'm going to be coming to. I'm going to be coming to you. I'm going to be coming to your institutional repositories. You've already got a customer. They just haven't worked out yet how they're going to pay for it and how much of cancer that they're going to do. There's talk maybe we'll just do cervical cancer to begin with. I'm resisting that. I'm thinking we should do the lot. But it's immaterial. It's immaterial. You're already through a door here. And it's important that you're kept informed of how this is going. But I will come when they give the green light, if it is me doing it. I would come and say, right, your institutional repository, I want everything you've got on cancer or cervical cancer or whatever it is. And I'll expect it to be there, and it will be there because you've already got it. So I want you to think of this, it's not just about digitization and all the worries about internet speed, but actually this is a far higher thing, which is the national good. You're doing this for your country. And hampering this is actually doing a disservice to your country. And you should bear that in mind when you talk to people, that if they're actually hampering this, they're not helping. It's not just, no, not helping you. They're not helping every other man, woman, and child in their country. I want just a quick mention about a writer called Susan Sontag, dead now, unfortunately, but she was a very interesting woman. And she wrote a book called Illness as Metaphor. And this is her first opening paragraph. Illness is the night side of life. Everyone who is born holds dual citizenship in the kingdom of the well and the kingdom of the sick. Although we all prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. We're all going to fall ill. And when we do, we will want our doctors to be informed. This is one of those cases where if you don't do something, if you don't sew that button on, it'll come back and this will be the suit you have to wear to go and meet the Queen or something. You know, I think, oh no, I wish I hadn't lost the button now. You're going to be lying in a hospital bed with doctors who don't know. The knowledge that you know is in your library. And that's harsh. That is harsh, but it is a reality. We have a task, our generation has a task, and we can't shirk it. Well, we could shirk it, but it will only really come back to haunt us. We've got to take the transition from page to the chip. That's our job. Okay, we can't, and that's, I think, what everybody is signing up for. But no one's going to make this easy for us, and we've got to hack our own path. The Spanish poet Machado said, "There is no path except made by walking." Absolutely true. We're going to walk together, and we're going to help each other, and we're going to make our own path.